Yeah, the book was really written initially with parents in mind. And it was directed and geared towards, children from, ages of, let's say, 4 or 5 up to, 18, 19, 20. And it was really at the time directed towards a lot of the kids that were like my kids, right? Who were pretty high functioning, that were diagnosed with, let's say, ADHD, maybe mild autism, but also learning disabilities, dyslexia. And it was about, trying to help those kids. And initially, I wanted to keep it pretty simple, and using the principles of the functional disconnection, try to keep it very low tech and very simple, and really make it something that was really affordable, that you didn't have to use expensive equipment. Keep it more in kind of an academic education world. And even as we built the business, we didn't want it to be in the healthcare world. We wanted it to be really more special education, like academics, and not use, highly trained healthcare professionals. So it wasn't a healthcare model, and it was really designed to use some of the scientific principles to change the brain, but really geared towards kids and higher functioning kids, and, using very simplistic ways. As we were getting more and more results, we'd get parents that would come to us and say, well, my child's doesn't speak, and they're autistic, and their behavior is really difficult, and they're really aggressive, or they have a genetic disorder, or they have a brain injury, or what about my kids that have all these other metabolic issues going on, or what about my adult kid now that is 30 years old and they're suffering, or what about my child that's 35 and has bipolar disorder or schizophrenia. And that was completely outside of the realm of what I created in the brain balance model and the brain balance programming. But it was something that I ultimately always wanted to have an impact on. And so the Melillo Method was the evolution of that. And it's really a completely different model. I mean, if you come into my office and my clinic, it's completely different than if you go into a brain balance center. They're completely different models. For me, they're completely different kind of patient population. Most of what we work with in my practice is really non-speaking autistics of all different age groups, or genetic disorders, or brain injury, or adults with things like bipolar, anxiety, schizophrenia. We work with infants, and we use really high-tech stuff like the cutting-edge tools. And it's all healthcare practitioners. And it's a much more sophisticated model.